Assalamu alaikum. Bismillahirrahmanirrahim. My name is Dr. Rida Shehram Sarwar, and under my kind supervisor, Professor Dr. Saira Afzal, I will be presenting human resource management today. Quote of the day is, if you can't fly, then run. If you can't run, then walk. And if you can't walk, then crawl. But whatever you do, you have to keep moving forward. Martin Luther King Jr. Our learning outline for today is definition of human resource management, health worker cadres, components of human resource management, benefits, planning, recruitment and selection, performance management, salary and reward, conflict management, and role of employee and employer. At the end of the presentation, participants will have a broad overview of what human resource management is, what its components are, and what benefits a strong human resource management program brings forth. The role of employee and employer will be highlighted, and a sound understanding of performance, conflict management, salary, and reward will be understood by the participants. Human resource management is the critical management area that is the most important asset for any organization as well as healthcare system. It is the integrated use of system, policies, and management practices to support the organization to meet its desired goal through recruitment, maintaining, and development of employees according to the Management Sciences for Health. Human resources for health, as defined by WHO, is all people engaged in actions whose primary intent is to enhance health. Health workforce is another way to refer to HRH. The human resource management is the process of planning, attracting, developing and retaining the human resource employees as part of an organization. The value of investing in the health workforce. The benefits include, first of all, improved health outcomes. Health workers drive health systems to deliver healthcare services, global health security, skilled health workers, improved health systems, resilience and responsiveness, economic growth. That is, the community's productivity is greater when it's healthy. Components of human resource management include human resource planning, which is strategic HR planning and job design, attracting employees, which is a part of recruiting and selecting, developing employees, which is training, development, and performance appraisal, and then retaining these employees with the help of compensation, maintenance, labor relations, as well as separation. Human resource planning, estimating the requirement of human resources for health. It includes the estimation of numbers and categories of personnel required both in the immediate and long-term staff, and the allocation of resources required to train and pay them. There are four methods used in calculating the health personnel requirement. These include the health needs approach. This approach is based on assessments by experts of the future health needs of a population that is based on demographic and epidemiological forecasts. Healthcare demands or utilization method. The health staff requirement is estimated by taking into account the effective demand, which is through the utilization of services. And then there's going to be human resource to population ratios. That is, the number of health workers required is calculated by taking into account the population to be served based on desired empirical or normative population to health workers ratio. And then there's going to be the service targets. This approach involves the setting of specific health service targets and then assess the personnel requirement to accomplish each of these by taking into account priorities, health needs, technical and financial feasibility of providing these services. Human resources for health strategy. The workforce 2030 objectives include, first of all, optimizing the human resources for health performance, quality, as well as impact, align HRH investment with the health needs, strengthen HRH data, and then build HRH institutional capacity. Okay, so this is basically the process of human resource management, which includes good employment policy, adequate financial resources, pre-service education training, partnerships with local communities, private sectors, donors, and key stakeholders, also leading to leadership and advocacy. It's an ongoing process, and all of this go hand in hand with contributing to better health outcomes. Benefits of a strong human resource management system for the organization include increase the organism's capacity to retain staff and achieve its goal, increase the levels of employees' performance, use employees' skills and knowledge efficiently, save costs through improved efficiency and productivity of workers, and improve the organization's ability to make change. Then benefits for the employee include improves equity between the compensation of employee and the level of responsibility, helps employees understand how their work relates to the mission and values of an organization, helps to motivate employees, helps increase employees' job satisfaction, and encourages employees to work as a team. Defining human resource management. This is the integrated use of system, policies, and management practices to support an organization to meet its desired goal through recruitment, maintaining, and development of employees. Attempts maximum utilization of pool skills as well as experiences. The needs in the health sector. Requirement of varied manpower, non-skilled to highly skilled. Outcome of any program depending on competencies and skills of implementing personnel. Mismatch between requirement and production of manpower. Continuous updating of skills and knowledge has not been made mandatory, and regional disparities in both quality and quantity of data. The components of human resource management begin with planning and then recruitment and selection, training and development, performance management, salary and reward, career management, and then retention and attrition, which also is then going to lead to planning. Human resource planning. The planning includes all activities required to forecast current and future HR needs needed when a new program is envisioned, needed to be done prior to recruitment and selection, demands forecast, estimate number and qualifications needed, and supply forecast, estimate availability and qualifications of current workers. So all of this falls under job analysis, job specification, and forecasting manpower. Determinants required for the job include skills, duties, knowledge, and training. Job specification includes minimal acceptable standards, that is, educational qualification, training, and experience. And forecasting manpower is projected turnover, suitability of existing employees, as well as budget availability. Recruitment and selection. Recruitment means defining jobs as well as inviting applications. Selection means the specific filtering process for choosing the most suitable personnel. This includes external, internal, as well as outsource. And then there's medical, fitness, and police verification, and then probation. The selection tools needed for recruitment and selection include cognitive ability tests, personality tests, group discussions, performance tests, as well as interviews. This is the recruitment pyramid, and it shows you through an example how people are selected in this process. For example, there's 1,000 applications received, 200 are called for interview, 150 show up and are then interviewed, 50 are selective, and out of those 50, 35 are going to join the job. Training and development, an act of increasing knowledge and skills of an employee in order to do a particular job. Help personnel and adults, and we use the principles of adult learning. It's a participatory approach, and experiences are to be shared. Initial period is best for training. There's introduction to goals, vision, mission, work culture, and hierarchy is also explained. There's a job description chart, and induction and pre-placement training, reorientation, and then there's also refresher training. Performance management. First, you have to define the performance by setting standards, targets, and mutual agreement. Then there's regular review and monitoring with the help of verbal, written, reprimand, and appreciation. Then there's feedback from employer, employee, needed support and actions for misconduct. There's corrective action through immediate supervisor or monthly meetings. Performance appraisal and evaluation in terms of quantity, quality, expectations, achievement, feedback, competency versus reality. And then there's training and development, plan, salary, and career development, all of which are linked to performance. Um, Organization basically has standing orders about conduct procedure for disciplinary action. All employees are treated at par. Initial verbal warnings are given by the immediate supervisor, which will then lead to written warnings. Charges are communicated, opportunity to defend, which leads to penalty. Major penalties include compulsory retirement, removal from service with or without future disqualification, and minor ones reported to the head office are censure, withholding of promotion, withholding of increment, and reduction to a lower scale. And then there's appeals. Performance appraisal system is going to be brought into effect. The current practice is known as the annual confidential report. It is a graded response. Unusual way is expenditure of grants, record observations on certain aspects of work. Excellent appraisal leads to potential for promotion. Salary and reward management. Generally, Government wages are quite fair. Each designated post carries a pay scale. Salary doesn't commensurate with performance based on qualification and years needed for qualifications. Difference between regular and contractual employee, enthusiastic and best performer may lose interest. Salary is also linked to inflation rates, incentives, additional increments, and out of turn promotions. Career management. Management should assist employees to achieve realistic goals. This is done in the form of timely promotions, opportunity to acquire additional qualifications, clearly defined promotion policy, and seniority as well as merit based. This is basically in the form of the 5 to 10 years is known as your trial stage, 10 to 20 years is stable occupational goals, 20 to 30 years, the person is going to secure and maintain their place, and greater than 30 years is going to lead to reduced power, salary, as well as responsibility. Retention and attrition. Retention is when a worker remains with an organization for a long period of time. Attrition is departure of employee. If premature departure cycle is repeated and it's quite resource consuming. Then what is morale and motivation? This is the welcoming of new ideas, the process of recognition and reward, helps in succeeding, thank you notes, huddle, open up, have fun, add perks, and let resistors go. And then you measure morale. You can do this with the help of the Maslow's hierarchy of needs. Motivation is generally the set of processes that are going to drive people towards a goal. As you can see at the bottom of the pyramid are physiological needs, which include air, water, food, shelter, sleep, clothing, and reproduction. Then there's the safety needs, which include personal security, employment, resources, health, and property. Then there's love and belonging, which is friendship, intimacy, family, and sense of connection. Then there's esteem, where there's respect, self-esteem, status, recognition, strength, and freedom. And then there's self-actualization, which is desire to become the most one can be in their capacity. Conflict management. This is basically requires working through differences, authentic communications between and among members, building trust and support, general respect for differences in idea, knowledge, attitude, as well as emotional status, role clarification, job description, personnel problem. You can basically do resolve this with the help of counseling. Lack of motivation. There's an ongoing in-service program, and grievances must be addressed fairly as well as quickly. There are problems that are known by others and then they're unknown by others. There needs to be an open free area, and then there's basically feedback for solidification, which is mainly going to be known as the blind area. Something that is known by self and something you need to ask is what's going to help discover what is unknown by oneself. Then unknown by others is basically self disclosure and exposure, and this is the hidden area. And then the unknown area are others observations, shared discovery, and then there's self discovery. Employee welfare. Anything done for intellectual, physical, moral, and economic betterment of an employee by employer, government over and above what is laid down by the law or what is normally expected of the contractual benefits for which the worker may have bargained for. Examples of this include adequate canteens, rest and recreational facilities, sanitary, medical facilities, travel arrangements from and to accommodation, as well as social security. These can be provided within or outside from the establishment. Grievances. Grievance handling is done by head superiors, but however, they perform technical and professional duties as well. And without having proper skills, heads can interpret conflicts as personal attack. There's a grievance procedure that's basically a mechanism by which employees' disputes and problems are handled in a fair and a just environment where conflicts are settled amicably. There is a need for a grievance committee. The reason for this is that enables employees with the means of airing dispute without any fear or hesitation. It renders decision-making authority as neutral. Supervisor, the immediate person involved, may lack necessary skills as well as authority. It allows employees to bypass immediate superior for a just cause and can avoid union action as well as strikes. This is basically the grievance procedure. And in step one, if an employee faces a grievance, they must discuss it with immediate supervisor. And if it can't be resolved, then you go to head level. Then there's step two. If it's not resolved at head level, there's a grievance committee. Then there's step three. A committee with democratic principles to resolve. And there's basically step four. Committee decides whether someone is guilty or not. And if someone is guilty, there's penalty or administration. And then step five, committee is going to evaluate its own actions if they are protested by the people. The role of an employee. A perfect employee or an ideal employee is someone who says to possess these following attributes, which are that he is ambitious, confident, humble, committed, reliable, positive, enthusiastic, culturally fit, self motivated, hardworking, has team spirit, is punctual, proactive, creative, honest, a communicator, and has good leadership qualities. And on the other hand, someone who is a good employer or a boss has the following qualities: that he has a clear vision, must know how to execute, is supportive, decisive, available to employees, leads by example, sets standards and demands results, shares relevant information, shares credit, cares about well being, respects employees, delegates appropriately, empowers, mentors, appreciates, listens, and is always neutral. Now we are going to come to the recent advances. Human resource management in the healthcare industry. Abstract. It has been said that managing change is a synonym for managing people through change. No other industry has experienced more change in the past 10 decades than the healthcare industry. In order to regulate all this change, managers in the healthcare organization must identify new ways to deal with these changes. These issues are as old as time: job satisfaction, cultural conflict, and compensation. This paper addresses each of these key issues with the following example: a new nursing paradigm that what was implemented at a hospital has significantly increased job satisfaction. It also takes a look at ways to manage cultural conflict in a diversified workforce. Finally, the results of a team approach to compensations are studied. And then the importance of human resource management in healthcare, a global context. Background. This paper addresses the healthcare system from a global perspective and the importance of human resource management in improving overall patient health outcomes and the delivery of healthcare services. The methods used are: we explored published literature and collected data through secondary sources and the results. Various key factors emerged that clearly affect healthcare practices and human resource management. It is also revealed how human resource management is essential to any healthcare system and how it can improve healthcare models. Challenges in healthcare systems in Canada, United States, and various developing countries are examined with suggestions for ways to overcome these problems through a proper implementation of human resource management practices. Comparing and contrasting selected countries allows a deeper understanding of the practical and crucial role of human resource management in healthcare. Conclusion. Proper management of human resource management is critical in providing a high quality of healthcare. A refocus on human resource management in healthcare and more research are needed to develop new policies. Effective human resource management strategies are greatly needed to achieve better health outcomes from and access to healthcare all around the world. Coming to MCQs. Question number 1. Human resource management is the critical management area that is the most important asset for any organization as well as healthcare system. Which access of human resource management in social work involves identifying and defining jobs and responsibilities? A. Recruitment and selection. B. Employee training and development. C. Performance management. D. Compensation and benefits. Or E. Strategizing and distribution. E.
A.
Yes, the answer is
A.
A. Question 2. The human resource management is the process of planning, attracting, developing, and retaining the human resources which are employees of an organization. Which area of human resource management focuses on creating a positive work environment and fostering employee engagement? A. Employee relations and engagement. B. Workplace health and safety. C. HR planning and strategy. D. Ethical considerations in human resource management. Or E. Training and development.
A.
A.
Yes, the answer is A. Question 3. Health work adders include physicians, nurses, midwives, dentists, and allied health professionals such as pharmacy and lab techs, and community health workers. What is the value of investing in the health workforce? A. Improved health outcomes. Healthy workers drive health systems to deliver healthcare services. B. Economic growth. A community's productivity is greater when it's healthy. C. Global health security. Skilled workers improve health systems resilience and responsiveness. And workers that feel valued, safe, and healthy are more likely to be productive and committed to their work. Or E. All of the above.
E.
Yes, the answer is E. 4. Which of the following term is used for choosing the individual who is best suited to a particular position and the organization from a group of potential applicants? A. Recruitment. B. Staffing. C. Enrollment. D. Selection. Or E. Appreciation.
D.
Yes, answer is selected.
D.
Question 5. Maslow's hierarchy of needs is a theory of psychology explaining human motivation based on the pursuit of different levels of need. What need forms the top tier of the pyramid? A. Safety needs. B. Self-actualization. C. Esteem. D. Physiological needs. Or E. Love and belonging.
B.
B. B.
B.
B. Yes, the answer is B. Question 6. Anything done for intellectual, physical, moral, and economic betterment of a worker by employer or government over and above what is laid down by the law or what is normally expected of the contractual benefits for which the worker may have bargained for comes under A. Employee satisfaction. B. Employee welfare. C. Employee engagement. D. Employee turnover. Or E. Employee motivation.
B.
Yes,
B.
the answer is employee welfare.
B.
Question 7. What programs are designed to help employees whose job performance is suffering because of physical, mental, or emotional problems? A. Employee assistance programs. B. Wellness programs. C. Safety programs. D. Managed health. Or E. Retirement package.
B.
A. Yes, answer is A.
Elf.
8. Management should assist employees to achieve realistic career goals with timely promotions and opportunities to acquire additional qualifications. The initial 5 to 10 years are considered what stage of career management? A. Reduced power, salary, and responsibility age. B. Stable stage with occupational goals. C. Trial stage. Or D. Security stage with maintenance of place. Or E. Decline stage.
C.
A. Yes, answer is C. Trial stage. Question 9. A standing orders about conduct procedure for disciplinary action within the organization come under performance management. What comes under minor penalties? A. Future disqualification. B. Senior withholding of promotion and increment. C. Compulsory retirement. D. Removal from service. Or E. Banning from the firm.
B.
Yes, the answer is
C.
B. Question 10. A list of duties, responsibilities, reporting, relationship, working conditions, and supervisory responsibilities of a job as a product of job analysis is A. Job enlargement. B. Job design. C. Job description. D. Job enlistment. Or E. Job retirement.
C.
D.
Yes. Yes, answer is C. Job description. This is the key for my MCQs. These are the resources I used to make this presentation. And this is the link to the YouTube channel where this presentation as well as others will be uploaded. Thank you.
Thank you very much, Dr. Rida. Very nice presentation. There are very important components that are crucial while we are talking about the management. One is the human resource management, the second is the project management, and the third is about the timelines and the planning cycle. So the first part has been covered, that is the human resource management, their selection, recruitments, and performance evaluations. However, there is a missing part of feedback, effective feedback, 360-degree feedback. And in project management, we know there are certain PC1, PC2, PC3, PC4, and they have a very important role in the projects, and their evaluation as well as timely completion is the crucial part. Then we have a planning cycle. Again, we have certain type of analysis to know that which situation should have certain important implementation steps. Then we have a complete cycle to implement, and then we have certain important methods in order to do evaluation. That is an ongoing process as well as at the completion of the project. With these things, I think we have covered it wonderfully, and everyone is requested that during face-to-face meeting, please also go through the project management, leadership, and the important concepts of Gantt chart, timelines, money management, material management, and human resource management. Okay, thank you very much, and see you today. Allah Hafiz.
Thank you, ma'am.
Thank you,
Allah
ma'am.
Hafiz.